My name's Lauren. I'm an NUR 119. Do I have your consent to send this to my advisor?
Yes.
Thank you. You can scan. Okay. Today we're going to be performing a neuro and musculoskeletal assessment. Have you ever had that done?
Yes.
Okay. My name's Lauren. I'm your nursing student. Checked your chart and your allergies. Everything looks correct. Can I see your armband? Oh, my sinuses. Okay. Can you tell me your name?
Cassie Carter.
Okay. Can you tell me your date of birth?
9/22/03.
Okay, great. I provided privacy, performed hand hygiene, gathered my supplies, and I reviewed your vital signs. Okay, so can you tell me where you are today?
I'm in the hospital.
Okay, and we're assessing for level of consciousness right now. Can you tell me what year it is?
2022.
Okay, can you tell me what you ate for supper?
Pulled pork.
Okay, and now I would assess for the patient's mood and affect, and I would say the patient's smiling and pleasant. Okay, can you tell me if you have any siblings?
I have 3.
Okay, could you tell me their names?
Holly, Mason, and Grayson.
Okay. I think we're good. Okay. Can you stand up for me, please? We're gonna assess your gait, so if you'll just take 5 to 6 steps. Okay. And if you'll remain standing, I would say the patient has a normal gait. Now we're going to do Romberg test, so if you'll stand with your feet together, eyes closed, and try not to sway. You would do this for 20 seconds. Oh, my nose is so stopped up. Okay. She didn't sway, so I would say her results were negative. Okay, now let's go ahead and do the heel to shin test while you're standing. So if you'll just take your heel and run it down your shin. Since you're standing, we'll go ahead and palpate the spine. Have you had any tender? You're good, whatever. Have you had any tenderness?
No.
Okay. Okay. I would say she has good posture. There's no curvatures in the spine. It's straight. Okay, you can sit down. Now we're gonna test upper extremities. So you're just gonna touch my finger, then touch your nose. Okay. Okay. Let's go ahead and assess your. Oops. You'll look over my shoulder. Okay. Pupils constrict evenly. They're symmetrical. So, can you stick out your tongue for me? Good job. Oh, my pen light's here. Can you say ah and stick out your tongue? Okay, the palate rises symmetrically. I'm gonna touch your face. Okay, tell me where you feel it. Cheek. Okay. And then I'm gonna do your, tell me if you feel it on your arm, okay?
Yes.
Okay, now I'm gonna raise your pants leg up. Okay, just tell me when you feel it.
Yes. Yes.
Okay. Now keep your eyes closed. We're gonna do sharp to dull, so you just tell me if you feel sharp or dull. And I would have done that field test bilaterally. Sharp.
No.
Sharp. if you'll cover one ear, I'm gonna whisper 3 words in this ear and you'll repeat it back to me. 1, 2, 3. Okay. And then we'll do it to the opposite ear.
ABC.
Okay, good job. Let's see. Okay, if you'll follow my finger only with your eyes, do not move your head. Okay, now you'll shrug your shoulders while I apply pressure. Okay, and now we're gonna do range of motion while we test her muscle strength. So if you'll flex and extend your arm, okay, and then we'll flip it, elbow, wrist, okay, now leg, and your foot, okay. You would do this bilaterally. Okay, now with range of motion, you're just gonna flex and extend. Okay, now supination and pronation of the wrist. Okay, and flexion and extension of the knee. Okay, dorsiflexion and plantar flexion of the foot. Okay. If I could check your radial pulses. And you would do this bilaterally, which I am. Okay, pulses are strong, they're symmetrical. You can take off your shoe, please. Now you're going to check the dorsalis pedis pulse. And you would do this bilaterally. Okay, you can put your shoe back on. Okay, can you smile for me? Frown. Puff out your cheeks. Thank you. Raise your eyebrows. Okay. Okay, now we're gonna palpate the arm. Well, you're gonna palpate one side of the body. So, right now you're checking for muscle tone. I would have graded her muscle strength of 5 as well. Okay, muscle tone is good. I would also have my client cover one eye and read the smallest line on the Snellen chart and then do the same to the opposite eye. Reflex. I'm gonna check your nice little knee reflex. Good, you got good reflex. Okay. Okay, I would perform hand hygiene, review vital signs, make sure my client is in a safe position, place the call light in reach, and document my findings. You can scan.